Which of the following is a term for an abnormal surge or excess of electrical activity in the brain? A. Dyskinesia. B. Twitch. C. Spasm. D. Seizure. The answer is D. Seizure. A seizure is defined as an abnormal surge or excess of electrical activity in the brain. This can result in partial or total loss of consciousness, and may cause muscular spasms, twitches, or other types of dyskinesia, disorders of movement. Spasms, twitches, and dyskinesias are not always caused by seizure disorders, however, they may be caused by a wide range of neuromuscular dysfunctions. Schizophrenic individuals frequently have abnormally high levels of what signaling molecule? A. Serotonin. B. Acetylcholine. C. Norepinephrine. D. Dopamine. The answer is D. Dopamine. While many people with schizophrenia do seem to have dysfunctions in multiple signaling molecules, excess levels of dopamine have been clearly associated with this disorder. Hank is a schizophrenic 46-year-old male. He experiences a persistent belief that a particular television commercial actor is addressing him directly, and that the commercial was created specifically to communicate with him. What type of delusion is Hank experiencing? A. Delusion of control. B. Erotomania. C. Delusion of reference. D. Kota or delusion. The answer is C. Delusion of reference. The belief that general or innocuous events exist specifically for or relate specifically to an individual is called a delusion of reference. Examples include belief that a billboard or television commercial is attempting to communicate directly to an individual, the ascribing of significance to random coincidences, or the observation of coded signals or signs in the general environment. Charlotte is a 19-year-old female with new onset of paranoia and auditory hallucinations. She has a positive family history for schizophrenia. Recently she admitted to her nurse that she can hear what other people are thinking. As she describes it, this does not come in the form of sound, but is communicated directly to her brain. Charlotte is likely experiencing which of the following? A. Thought broadcasting. B. Auditory hallucination. C. Telepathy. D. Delusions of persecution. The answer is A. Thought broadcasting. The belief that other people can hear one's thoughts is described by the term thought broadcasting. This is a common symptom in schizophrenia. It is differentiated from telepathy in that thought broadcasting, there is a delusion that thoughts can be heard by anyone, while telepathy is generally nonverbal communication between specific individuals, and may be receptive as well as projective. Auditory hallucinations are false perceptions of sounds, or internal thought perceived as emanating from another source, while delusions of persecution can take many forms but generally include a degree of paranoia or feeling of being targeted for harm or attack. The term positive symptoms in schizophrenia refers to which of the following? A. The loss of a specific sense, such as loss of sense of smell, anosmia. B. Any cognitive excess or distortions, such as delusions or hallucinations. C. Any symptom that increases confidence or leads to grandiosity. D. Repetitive physical movements or gestures. The answer is B. Any cognitive excess or distortions, such as delusions or hallucinations. Positive symptoms in schizophrenia are any symptoms of cognitive excess or disordered thinking. These include delusions, such as delusions of grandeur or persecution, hallucinations, and disorganized speech or behavior. Which of the following conditions can decrease sensitivity to sweet and bitter tastes? A. Rheumatoid arthritis. B. Psoriasis. C. Depression. D. ADHD. The answer is C. Depression. Depression has been linked with alterations in taste sensation, including decreased sensitivity to sweetness. This may contribute in some part to the high consumption of sweet foods and certain individuals experiencing a depressive episode. None of the other conditions listed have been correlated with alterations in taste receptor function. You're an emergency department nurse taking care of a 16-year-old female who complains of fatigue and syncope. You learn that she has only been drinking water for the last 2 weeks and has only been eating a piece of bread per day for the last 4 weeks, as she is worried that her classmates may make fun of her for being too fat during her upcoming dance. Her BMI is 14. Which of the following is the most likely diagnosis? A. Bulimia nervosa. B. Anorexia nervosa. C. Binge eating disorder. D. Major depressive disorder. E. Generalized anxiety disorder. The answer is B. Anorexia nervosa. In this patient, who is a young female, which is the most commonly encountered demographic for eating disorders, she notes that she has been drastically restricting her intake of food, that she has body dysmorphic thoughts, for example thinking that she is too fat despite that her BMI is 14, and we learn that her BMI is 14. A diagnosis of anorexia can be made if a patient is restricting their eating or drinking intentionally, and or is participating in purge behavior, and has a BMI less than 17.5, as in this patient. While generalized anxiety disorder and or major depressive disorder are often comorbid in patients with eating disorders, there is not enough evidence in the example to suggest either diagnosis for this patient. A syndrome of pain in the front of the knee, frequently occurring in teenagers, manual laborers, and athletes. It's sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. What condition is described? A. Legg-Calvé-Perthes syndrome. B. Osgood-Schlatter disease. C. Patellofemoral syndrome. D. Congenital scoliosis. The answer is C. Patellofemoral syndrome. Patellofemoral syndrome presents as pain in the front of the knee, sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. Osgood-Schlatter disease is a syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Legg-Calvé-Perthes syndrome is due to disruption of blood flow to the femoral head, leading to a vascular necrosis. Congenital scoliosis is a spinal deformity characterized by the curving of the spine at an angle greater than 10 degrees on radiography. What condition is described by the following? A syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. A. Osteomalacia. B. Osteosarcoma. C. Osgood-Schlatter disease. D. Slipped capital femoral epiphysis. The answer is C. Osgood-Schlatter disease. Osgood-Schlatter syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Risk factors may include overzealous exercise, but it's ultimately thought to be caused by adolescent bone growth. Osteosarcoma, the most common bone cancer in adolescent populations, can present with pain and a lump or frank swelling. This is caused by actual tumor growth, not by any ligamentous issue. Osteosarcoma does present frequently in the knee, and must be ruled out before a diagnosis of Osgood-Schlatter disease is made. Slipped capital femoral epiphysis causes pain and reduced movement in the hip, rather than the knee. Osteomalacia is a general softening of the bones caused by a deficiency in vitamin D. What condition will show a pencil in cup deformity on X-ray? A. Psoriatic arthritis. B. Juvenile rheumatoid arthritis. C. Rheumatoid arthritis. D. Osteoarthritis. The answer is A. Psoriatic arthritis. Psoriatic arthritis will often show a pencil in cup deformity on X-ray. Osteoarthritis will show joint space narrowing, sclerosis, and osteophytes. Rheumatoid arthritis and juvenile rheumatoid arthritis will both show soft tissue swelling, joint space narrowing, and may show marginal erosions. Rheumatoid arthritis typically presents with what type of deformity in the distal joints of the fingers? A. Shepherd's crook deformity. B. Heberd node. C. Swan neck deformity. D. Pencil in cup deformity. The answer is C. Swan neck deformity. Swan neck deformity is often seen in patients with rheumatoid arthritis. This is a state in which the distal interphalangeal joint, dip, becomes hyperflexed, bends toward the palm, while the proximal interphalangeal joint, pip, is hyperextended, bending away from the palm. Shepherd's crook deformity is seen in Paget's disease of the bone, pencil in cup deformity is seen in psoriatic arthritis, and Heberd nodes are frequently seen in the distal phalanges of patients with osteoarthritis. What is the most common form of muscular dystrophy? A. Emery-Dreifuss. B. Duchenne. C. Becker. D. Myotonic. The answer is B. Duchenne. Duchenne's is the most common and most severe form of muscular dystrophy, accounting for a full 50% of cases of muscular dystrophy in the U.S. The next most common type is Becker's, followed by myotonic muscular dystrophy and Emery-Dreifuss. Which of the following conditions is associated with autoantibodies to presynaptic calcium channels? A. Myasthenia gravis. B. Lambert-Eaton syndrome. C. Dermatomyositis. D. Multiple sclerosis. The answer is B. Lambert-Eaton syndrome. Lambert-Eaton syndrome is a condition of progressive muscle weakness caused by an autoantibodies to presynaptic calcium channels in the neuromuscular junction. This does not allow calcium to enter the presynaptic cell, which is required for neurotransmitter release into the synaptic cleft. Without the release of neurotransmitter, there will be no muscular response. Myasthenia gravis is an autoimmune condition in which antibodies are formed against acetylcholine receptors, and muscular weakness and multiple sclerosis is caused by destruction of myelin in the CNS due to antibodies against oligodendrocytes. Dermatomyositis is an inflammatory connective tissue condition that may be associated with a post-viral autoimmune reaction or triggered by a perineoplastic syndrome. What are the classic histological findings of dermatomyositis? A. Fibrous muscle fibers and fatty infiltrates. B. Parafascicular muscle fiber atrophy and fatty infiltrates. C. Granulomas and necrotic muscle fibers. D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. The answer is D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Histological findings of dermatomyositis will generally reveal mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Fibrous muscle fibers and fatty infiltrates are typical of Duchenne's muscular dystrophy, while granulomas in muscle are rare but may be seen in sarcoidosis and other conditions of granulomatous myositis. 90% of adult rhabdomomas are located in what area? A. The calf. B. The upper arm. C. The lower back. D. The neck. The answer is D. The neck. A rhabdomoma is a benign tumors of striated muscle. 90% of adult rhabdomomas present as round masses in the neck. What dermatological condition is often seen with dermatomyositis? A. Periorbital heliotrope rash. B. Perioral dermatitis. C. Dermatitis herpetiformis. D. Miller rash. The answer is A. Periorbital heliotrope rash. A periorbital heliotrope rash is often seen in dermatomyositis. It is bilateral, symmetric, purpuric, and macular, and erupts over the eyelids and surrounding periorbital area. Miller rash, often called a butterfly rash, is seen in patients with systemic lupus erythematosus, SLE. Dermatitis herpetiformis is a rash on the elbows and knees generally seen with gluten allergy, celiac disease. Perioral dermatitis is an iatrogenic condition often associated with prolonged use of topical steroid creams. What condition typically presents as symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness? A. Dermatomyositis. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Polymyositis. The answer is D. Polymyositis. Polymyositis is characterized by symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness. The first sign is often weakness in the thighs while walking, the inability to rise from a seated position without assistance, or the inability to raise the arms above the head. Dermatomyositis generally includes a characteristic periorbital rash. Weakness is expressed in the neck, arms, and legs. Guillain-Barré syndrome is an ascending paralysis. Symptoms start in the hands and feet, then spread proximally as it progresses. Muscular weakness in myasthenia gravis is often especially expressed in muscles of the face and head, especially those that control eye and eyelid movement, facial expression, chewing, swallowing, and speaking. What condition is characterized by high bone turnover due to accelerated osteoclast and osteoblast activity? A. Osteogenesis imperfecta. B. Giant cell tumor. C. Paget's disease of bone. D. Multiple myeloma. The answer is C. Paget's disease of bone. Paget's disease of bone is a condition characterized by high bone turnover due to accelerated osteoclast and osteoblast activity. This results in increased calcification of bones, especially prominent in the skull, pelvis, femur, and tibia. Osteogenesis imperfecta is an issue with collagen formation that causes fragile bones and multiple fractures. Multiple myeloma is a malignancy of plasma calls, and giant cell tumors are rare tumors that generally originate from the epiphysis of long bones, with no effect on bone deposition. At what age will Paget's disease of the bone generally first present? A. Over 70. B. Children ages 6 to 12. C. Early adolescence. D. Over 55. The answer is D. Over 55. Paget's disease of the bone generally presents in after the age of 55, and is very rare in younger individuals. The prevalence in individuals over 55 is as high as 3%. Which of the following is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone? A. Osteoid osteoma. B. Ewing's sarcoma. C. Osteosarcoma. D. Fibrosarcoma. The answer is A. Osteoid osteoma. Osteoid osteoma is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone. Fibrosarcoma, osteosarcoma, and Ewing's sarcoma are all malignancies. What is the most common primary malignancy of the bone, excluding hematopoietic malignancies? A. Osteoid osteoma. B. Fibrosarcoma. C. Ewing's sarcoma. D. Osteosarcoma. The answer is D. Osteosarcoma. Osteosarcoma is the most common primary malignancy of bone, excluding hematopoietic malignancies, making up approximately 20% of all primary bone cancers. Fibrosarcoma and Ewing's sarcoma are relatively rare conditions, and osteoid osteomas are as non-malignant. About 75% of osteosarcomas occur in what region? A. The upper arm. B. The distal femur or around the knee. C. The pelvis. D. The thoracic spine. The answer is B. The distal femur or around the knee. Roughly 75% of osteosarcomas occur in the distal femur or around the knee. The next most common site is the upper arm. Spinal or pelvic involvement are rare. The majority of osteosarcomas occur in what age group? A. Individuals over 65 years of age. B. Preteens and adolescents. C. Middle age. D. Children under 10. The answer is B. Preteens and adolescents. The majority of cases of osteosarcoma are in children and adolescents between the age of 10 and 25. It's the most common type of bone cancer in children and young adults, and the third most common cancer in teens. Which of the following is a neurological movement disorder typified by sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain? A. Genius spasm. B. Dystonia. C. Bulismus. D. Torticollis. The answer is B. Dystonia. Dystonia is a condition of sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain. Torticollis is a form of dystonia specific to the muscles of the neck. Bulismus is a condition of rapid, violent involuntary motions. Geniospasm is specific to the mentalis muscle, causing involuntary movements of the jaw. A 35-year-old male client presents to the emergency department after sustaining a severe tibial fracture to the left leg. The nurse is assessing the injury for possible complications including compartment syndrome. All of the following interventions would be appropriate to compartment syndrome except dash. A. Assess the bandage applied, loosen if necessary. B. Assess urine output for dark smoky urine. C. Elevate the injured limb and apply ice packs. D. Notify the physician if no peripheral pulses are detected. E. Assess for paresthesis, pallor, and pain in the left lower leg. The answer is C. Elevate the injured limb and apply ice packs. Elevation of the limb above the heart may slow arterial perfusion and raise venous pressure, and worsen circulation. Ice may cause vasoconstriction and further lead to circulation compromise. Both of these interventions would not be appropriate for compartment syndrome. Know the 6 P's of compartment syndrome: pallor, pain on passive movement, paresthesia, paralysis, pulses, pressure. All of these may be present in compartment syndrome. Pulselessness is an ominous sign of impending permanent damage. The physician should be notified. Muscle damage can lead to myoglobinemia of the blood, thereby damaging the kidneys, leading to rhabdomyolysis and dark urine. A tight bandage could further increase the pressure in the compartment and should be loosened if this is so.